video looks at ACL rehabilitation. The first phase of ACL rehabilitation is knee mobility exercises. The reason why knee mobility is so important is post-injury you want to regain full range of motion to reduce any tension and pain around the knee. The main vectors of movement are knee extension, working through the quadriceps, but also we find with knee extension it tends to be the most restrictive through an ACL injury due to the fact that its function is to inhibit hyperextension. Another important vector through the knee is knee flexion. With this movement we want to gently rebuild the range of motion slowly in order to reduce any pain being caused by the movement, but also to regain full range of motion. We want to take the heel towards the bum, hold for a second, then relaxing back down. Over time this will help with fluidity within the joint and lubrication. We then want to integrate both movements with a body weight squat. This helps to use the strength through the knees, it helps to regain range of motion, but also putting gentle pressure through the knee joint. Again, aiming between 10 to 15 reps, lovely and slowly, gently regaining the full range of motion. Favourite mobility exercises post ACL injury is cycling. The reason why this is so important is it helps to regain full range of motion through the knee, not adding too much pressure through the knee joint, and helps to flush it out in order to increase lubrication of the knee joint. Phase 2 of the ACL rehabilitation is looking at knee stretching exercises. Again, this is trying to take away any tension formed within the muscles around the knee post-injury. The first stretch is stretching through the quadriceps, so the muscles around the front of the knee. This again is normally the most restrictive range of motion. We then want to reduce tension around the back of the knee within the hamstring belly. Again, gently using the body weight, bringing the chest towards the leg and holding in a position to stretch through. We want all of these stretches to be within a gentle range of motion, but also within a pain-free range of motion. Over time, you will be able to increase the range and deepen the stretch. It's also important to stretch through the rectus femoris muscle. Please pay attention when doing this stretch as you're applying pressure through the knee as you're stretching through the front of the quad. Only do this stretch if it feels comfortable and it's not too painful. Phase 3 of the ACL rehabilitation is knee strengthening exercises. This is vital to regain strength of the muscles around the knee in order to take the pressure off the ligaments. What you want to activate is the quadriceps muscle around the front of the knee in order to regain full range of extension, but also to allow the muscles to activate to take the pressure off the knee joint. It's also vital to activate the hamstring muscles around the back of the knee. This again is to regain full range of flexion within the knee joint, to strengthen the hamstring muscles to offset some of the pressure off the joints and the ligaments. This is vital to regain strength and confidence within the knee post-injury. Phase 4 of the ACL rehabilitation is vital to regain knee stability and agility. The knee has to be strong in different vectors of movement, i.e. different directions, different positions, but also in movement where you are jumping off the ground. This is vital as the ligament, muscles and joint need to be stable. The video demonstrates a variety of different ways to increase dynamic stability. It is vital that you move on to this phase of the rehabilitation when you have absolutely no pain in the knee. It feels nice and stable on movement, there's no tenderness on movement, and you have regained 95% at least range of motion post-injury. For more information, visit our website for a breakdown of the ACL rehabilitation.